Enjoy the people that you are going to accept as patients. And think of a consultation as an interview. You're interviewing the patient to decide if you want to have them as part of your practice.
Hello and welcome to Beauty in the Biz, where we talk about the business and marketing side of plastic surgery. I'm your host, Catherine Maley, author of Your Aesthetic Practice, What Your Patients Are Saying, as well as consultant to plastic surgeons to get them more patients and more profits. Now, today's special guest is Dr. George Bitar. He's a board-certified plastic surgeon and medical director of the Bitar Cosmetic Surgery Institute in Fairfax, Virginia, and has been practicing for the last 23 years. Now, originally from Lebanon, Dr. Bitar came to the U.S. when he was 16, and I'm going to ask him more about that. And then he went on to perform over 20,000 surgical procedures since then. His impressive training spans 6 continents, including mentorships with some of the world's most respected cosmetic surgeons in Rio, Paris, Melbourne, Johannesburg, and Beverly Hills. He's a published author and speaker and serves as assistant clinical professor at George Washington University. Now, Dr. Bitar receives numerous honors and awards for his medical research, is a speaker and member of several medical societies, and he does medical missions and volunteer work in the U.S. and abroad. Dr. Bitar is fluent in English, French, and Arabic, amazing, and is an accomplished watercolor artist and photographer, and you can see some of his work on his website, and actually right behind him, that's some of his photography on his video screen. So Dr. Bitar, welcome back to Beauty in the Biz. It's great to have you, and I meant to caveat. I'm welcoming him back because he came on a long time ago, back in May of 2020. He had just opened up a new practice and COVID hit, and he had time to talk to me then. So it's so great to have you back again.
Catherine, it's great to be back with you.
Would you please, I love your story, that journey from Lebanon to private practice in Fairfax, Virginia. What was that like?
So for those who don't know where Fairfax, Virginia is, we're in the greater metropolitan D.C. area. So I'm a stone throw away from the White House in Northern Virginia, right outside of D.C. And it has been a very interesting journey. You know, there was a war going on in Lebanon when I was growing up. And after living 10 years in war, my father and mother said enough is enough. And they packed our bags and brought us to the United States, basically with practically nothing except, you know, my father was a pediatrician. He just had gotten a job offer here. We practically lost all our money in Lebanon because of the devaluation of the Lebanese currency. And, you know, my father said, we're going to get you to the United States and I'm going to give you a green card and the rest is up to you.
Wow.
So, you know, I got here, I was 16. I had just finished high school in Lebanon. So I started college at 16 and it was challenging. You know, English was my third language at the time. I spoke Arabic, French, and English. And over the years, finished college between University of Missouri in Columbia, where we landed from Beirut, Lebanon, to graduating from George Mason University in Northern Virginia. And then I went to George Washington University for medical school in Washington, D.C., and I now serve on their medical admissions, the medical school admissions board, as well as an assistant clinical professor. Then I did the general surgery residency at Albert Einstein in Philadelphia. Then I did a plastic surgery residency at the University of Virginia. And after I finished my plastic surgery training, I decided I wanted to subspecialize in cosmetic surgery and to be able to give my patients the best results possible. So I did 2 fellowships. I did one fellowship, which was with a group of 12 board certified plastic surgeons in Charlotte, North Carolina. That was amazing training. And I learned a lot there about the principles of cosmetic surgery. But then because I'm going to be in Washington, D.C., and I felt like I'm going to have international clientele, I wanted to have an international flavor to my training. So I picked the top 6 plastic surgeons in the world and I went and trained with them. And that included Dr. Ellen Bogan in Beverly Hills, Dr. Marshak in Paris, Dr. Ivo Pitengui in Brazil, Dr. Mendelsohn in Australia, and Dr. Widgero in South Africa, as well as Dr. Giampapa in New York. So after I did my fellowship, I came here. I did not send a single resume, Catherine. I knew I wanted to be self-employed. I knew I wanted to create the practice that was my dream practice. And I came to Northern Virginia where my family was, and I started my practice 23 years ago, and it's been good stuff since then.
So you never joined somebody else's practice first or any of that?
No, when I started, I saw a plastic surgeon here in the DC area who had a plastic surgery practice. I asked her if I could rent 2 rooms from her to start my practice and got privileges at Fairfax Hospital. And basically, I negotiated for having the first 3 months rent free. And I asked her if I could use her instruments. So if I operated in the office, I didn't have the money to buy instruments. So I had like 3 months of free rent, free instruments, and I used her nurse when I started. And the only person who was either kind enough or loving enough to be my unpaid employee was my own mother. So when I started my private practice, I used to joke about the fact that I have a private practice and it's very private. It's me and my mother.
Was she a good employee?
She was an amazing employee, and she helped me start my practice. I think in my early days, I had this woman who was referred to me from London for an acid peel, and she was a diplomat here in DC. And after I met with her, then she was checking out. My mother was my only employee, my receptionist, and my assistant. And then she goes to my mother and says, "Oh, you have the same accent as the doctor." And my mother said, "Yes, I'm from Lebanon." She goes, "Oh, well, the doctor is from Lebanon also. How do you know the doctor?" And my mother said, "Well, I've known his father for a long time."
Oh,
And then she comes to me, she's like, "Can I tell people I'm your mother?" I'm like, "I don't care."
I know everyone's so funny about that. Like the wife, should I tell them I'm the wife or not? And I say, it just don't make it a big deal. It's whatever.
Right, exactly.
Yeah.
But anyway, so that's those very humble beginnings.
Well, they're not
And
humble anymore. Yeah.
I went to the bank to get like a $20,000 loan to start my practice, but because I had done like 9 years of residency and fellowships, my credit was like in the dirt. So instead of giving me $20,000, the bank gave me $10,000, and I basically started my practice with a $10,000 loan.
You do what you have to do. But it's amazing what you have done. Like explain how you've grown your practice. Describe what it looks like today.
So today we have 2 offices under one roof in the same building, but 2 separate and adjacent offices that are separated by a hallway. One serves as our med spa. It's a 3,500 square foot med spa that is fully equipped. We have 2 estheticians, a PA injector, and the supporting staff, the front desk staff, the medical assistants, and a marketing director. And next to it, we have our surgery center and medical practice where I am right now. And it's about a 6,500 square foot office with our own Quad A certified operating ambulatory surgery center with 2 operating rooms. We have our own anesthesia group, which are board certified anesthesiologists that rotate. So we have contracted with a group of anesthesiologists. So we have about 4 that have been licensed to come and operate in our center, and those 4 rotate. So at any given day, if one is sick or one is on vacation, I have an anesthesiologist. And I have my OR staff that is basically in the OR, and my clinical staff that helps with the pre-op and the post-op. And some of the people do overlap, like my medical assistants are medical assistants when I'm seeing patients in the office, but are surgical assistants when I'm operating in the operating room. So I train them to basically become surgical technicians after they were medical assistants. So that's the surgical aspect. And the newest addition that we have to our practice is our wellness center. So we hired a very well experienced nurse. She ran the plastic surgery program at Georgetown under the previous chairman, Dr. Spears. And then she was an entrepreneur as well. So she had her own wellness company that provided plastic surgeons with weight loss injections, with testosterone and bioidentical hormone pellets, as well as vitamin IV infusions for both wellness and post-op recovery. And, I interviewed her 2 years ago, and I think the chemistry between us was great. So we hired her, and she basically started the wellness program in our practice that we have grown since then. So the wellness program is part of our practice, even though it's kind of like somewhat has its own autonomy, but in the same location. So as far as the patients are concerned, our employee number varies depending on people with part-time and full-time, between 20 to 25 staffers that service the med spa, the wellness center, and the surgery center. And because it's under one roof, our patients can do their skincare here, injectables, machinery, all the bells and whistles, from M-Sculpt to Cool Sculpt to therapy to hydrofacials in the med spa, and all the surgeries that I do in the surgery center. I do face, body, and nose. I would say about 30% face, 30% body, and 30% nose. And I like it that way because I enjoy operating on the whole body. And then our wellness center here benefits from having our patients in proximity, from the med spa patients to the surgical patients to the wellness patients. So they all have, access to all our services. And I think patients appreciate that.
Well, you can become a one-stop shop for that patient who is not looking for saving a dollar. They're looking for convenience and relationship. And if you can make that happen, that's the holy grail. You want to turn one patient into a 10 times their value because they stay put and they come back again and again.
Well, and we have, I gave a talk recently at the New York meeting where you were at the Master Facelift and Rhinoplasty meeting. And I was asked to give a talk about our wellness program here. And I was kind of like half jokingly said that our patients are the CTPs and the CBTPs, that come to Papa and come back to Papa. And we'd like to convert all our come to Papa patients into come back to Papa patients, for obvious reasons.
Right. By the way, any tips on hiring, firing, motivating staff? That's a lot of staff to manage.
Well, I think the first step is I got to like somebody I'm interviewing, both patients and staff. For somebody who's starting out, I think that advice may not be very practical advice, because you say, oh, well, it's easy for you to say that. I want to hire, whatever I can get my hands on. I can tell you, though, maybe I'm in a privileged position that, I don't need to hire anyone. I don't need to operate anyone anymore at my stage in the game. I do it because I enjoy it. I do it because I like it and because it's my passion. So anytime I'm interviewing a patient, the first question I have on my mind is that a patient that I want to have if I have a complication with them? Is that somebody that I can work with, I can solve a problem with? And is that somebody that I would like to see them back in my office over and over again? Because we have a very extensive follow-up program. And patients come back to us day 1, day 3, day 7, day 5, day 7, day 10. We do Elixir MD treatments on them after the surgery. So I really got to like somebody before I decide to operate on them. And if I don't like them, I just simply tell them, I'm not the person for you. And likewise, they have to like me, because it's sort of like a marriage in which, the surgery is the easy part. You have to go through the healing, the results, there may be a touch up here and there. And you want those patients to represent you in the community and abroad. We have now patients, I think I stopped counting. We had like 105 countries that people have come from. I stopped counting after that. We have a map at the front of the office. And after we put so many pins in that map, we ran out of pins. So, but we have pins in about 105 countries. But
the map is really impressive.
If people come to you and you enjoy their company, that enriches your life. It enriches the staff's life. It makes the staff happy. So that's my biggest tip: is enjoy the people that you are going to accept as patients, and think of a consultation as an interview. You're interviewing the patient to decide if you want to have them as part of your practice, and they're interviewing you to decide if they want you as their surgeon. And quite frankly, I tell everybody, go get 3 consults. If I'm not the best person for you, then go with somebody else. Life is too short to be operated on by a plastic surgeon just because your doctor recommended them. You need to be convinced that that's the person for you. And I typically turn away about 20 to 25% of the people I interview. I'm very selective on who I interview on. I always tell my staff, not everybody who comes for an interview or a consult needs to be our patient.
For sure.
As far as the staff is concerned, I think I apply the same rules. I want somebody who's a team player, somebody who cares about their work, somebody who has work ethics, somebody who's a hard worker, because I am. My wife, who's our executive director, is even a harder worker than me. And so the two of us, we cannot tolerate somebody in our practice who's going to be lazy or who's going to be, goofing off. And quite frankly, it never gets to the point of us firing them. The rest of the staff are so motivated that if somebody comes and they're not pulling their weight, they usually feel uncomfortable and they leave on their own, because our staff will make it very clear to somebody that if you're not going to pull your weight here, you're not going to share in the, in the work that has to be done, then you're not going to be welcome here. And we are, we have a fun practice. We do a lot of activities. We have a great Christmas party. We have, a midsummer's fest. We have a lot of stuff going on, but the staff has to know that, primarily our job is to work and deliver top-notch results for our patients, and then everything else comes secondary.
How do you get that message across, and who's managing everybody, and how involved are you in the managing of staff and the admin side?
Well, I'd like to quote a quote from Henry Ford that I always tell it, and I tell it to my kids too. Henry Ford said there are two types of people who will never amount to anything in this world: the ones who only do what they're told, and the ones who can't even do what they're told. So I would like to raise kids, and I would like to hire staff who will do beyond what they're told. And I make it very clear to my staff. I say, you need to be 10 steps ahead of me. If I have to tell you what to do, it means that you are not doing your job. You need to tell me what needs to happen. You need to be 10 steps ahead of me. You need to feed me information. You need to know more about the patients than I do. You need to know what the day's program is. You need to come up with solutions. I don't pay you to come to me with problems. I pay you to come to me with solutions. So I'm a hard ass. I mean, I'm going to say that up front, but the people who accept that thrive here. The people who don't accept that, don't last here too long. And that's fine with me.
But you're in the middle of Washington, D.C. I've done a little HR. I'm done with HR. I give up with the new generation. It's not what I do, but I've often done it as a favor. I can't find good help. How are you doing it?
Meaning staff?
Yeah.
I think we are at a point right now that we are a prominent practice enough that, we attract good staff. Good people attract good people. And I feel that our patients who like us refer to us high quality staff. When we put ads on,
Indeed.
On the different sites,
Indeed.
We get people from LinkedIn, we get people from, what's the other staffing places?
Indeed or Monster.
We get from Monster,
or ZipRecruiter.
Indeed. We get from Quadrant, that is the local staffing agency here. But I think recently, in the last 5 years or so, most of our staff come from seeing us on Instagram or seeing our website or hearing about us and just sending us the resume, flat out emailing a resume. And then, my wife, who's our executive director, and Gerald, our office manager, they will kind of sift through those resumes. They see somebody they like. If it's on the admin side, they will interview them. If it's on the medical side, I will interview them. And we kind of make a consensus. But we've kind of came up with an agreement that all three of us have to like somebody before we hire them. Because, somebody can fool me or can fool one of them, but if somebody, is agreeable to all three of us, then we feel that it's a good person to hire. If one of us has a very negative reaction to that person, and then the other two have not seen that negativity, I think we go along with the person who says, that's a bad apple. We don't want them in our practice, because we have a very nice practice. We have a very nice team. And bringing a bad apple into the team, and I've done that in the past, it just ruins a rhythm, and we have a rhythm going on, and we have momentum going on. So I'd rather have a slot that's vacated than fill it with the wrong person. I'd rather for me to do more work than hire the wrong person to give them the work, because if you hire the wrong person, you end up doing the work double, you end up paying double to get rid of them or to fix their mistakes.
Hello there. Quick pause to ask you if you have gaps in your practice draining your time, profits, and peace of mind. If so, I can help you streamline, grow, and take the guesswork out of your practice. Book your practice growth strategy review at CatherineMaley.com, and let's turn those gaps into growth. Now, back to the podcast. Do you ever hire with their family and friends of the employees you already have?
We have, but our more common practice is we promote from within. So somebody who comes in as a medical assistant and they want to become an esthetician, we'll pay for them to go to esthetician school,
Nice.
with conditions. Like if we pay for your school, you owe us two years of being on staff. Now, obviously, they're going to be paid for those 2 years, but if they decide to leave after 1 year, then they reimburse us half of their, for example, esthetician school tuition. We feel that's fair. If we, for example, train somebody to go from one job to another that is a higher paying job, we would also like a commitment to say that if we train you to be a surgical technician and you are a medical assistant and a surgical technician gets paid more, we expect you to understand that, we spent our money and time to train you, and therefore, there has to be some type of a graded pay raise so that at the end of the day, it'll be fair for them, but it'll also be fair for us because those 6 months that they trained to be able to command a higher salary were done on our dime. So there has to be an agreement in when you raise somebody's salary, but you do it because you paid for them to learn more or to get a better education. That that person needs to understand that it's there has to be a give and take between the two parties. Otherwise, it will not work.
So you're asking for them to commit to staying for a certain amount of time? Is that it?
Or if they don't commit, then they pay us back for whatever the fee that we, spend to train them.
Got it. And has that worked well?
Has worked very well. I think people appreciate you being honest with them and telling them, look, your training costs us money.
Yeah.
And we're willing to do that because we prize you as an employee, but we cannot just train you for 6 months and then the minute that you train and you pass some certificate, you go and work for our competitors. That's not going to fly.
It's a great litmus test too, because if they won't agree to that at the forefront, then there's no need to go further because they're telling you their intent. So,
and I had that situation with a nurse, nurse injector who was very excited to come and work with us. And I told her, the minute that you start working here, your patients will become our patients. We're paying you a higher salary because you're bringing patients in. She's like, no, if I leave, those patients will leave with me. I'm like, no. I said, you cannot have two bites at the same apple. Either you come in with a lower salary and you can leave whatever you want, or you come in with a higher salary, but your patients become our patients. She did not agree to that, and we never hired her, and she went and worked somewhere else. And I'm fine with that, I think I'd rather set the expectations right from the get-go. We have a situation where we hired a PA who had her own skincare line, and she said, in order for me to work here, I would like to bring in my skincare line. And we said, fine, you can bring your own skincare line, but you have to sell of our skincare line a certain amount and of your skincare line a certain amount. So we struck a deal, and it has worked. So I think as long as you are honest with the person you're bringing on, and as long as they know what your expectations are, I think it works. I mean, when we've hired plastic surgeons in the past, I told them, expect to take home 20 to 25% of the money that you bring in. Any which way you cut it, slice it, and dice it. When our overhead is 70 to 75%, it makes no sense to pay somebody more than what you're making yourself. So if somebody comes and they think they're going to make 50% of what they bring in, that's basically a recipe for disaster. no plastic surgery practice that is functioning at our level, at a very high level, has a low overhead. They all have high overhead. And if you bring in an associate or a partner and the compensation exceeds what they're netting you, you're a bad business person, and those situations will not last long. I've seen other plastic surgeons who brought somebody and they said, well, we're going to pay you 50% of what you bring in. Right then and there, when I hear that, I think the person who offered that has no clue about business, and the person who accepted it has no clue about business, because they're going to be fired very quickly.
That used to be the going percentage, years ago, but everyone threw
That
that
was
around.
before you had to spend a lot of money to buy lasers and equipment.
True.
And I mean, we have hundreds of thousands of dollars worth of equipment here that when you bring somebody on board, all these things are available to them, by virtue of being in the practice. Well, there's a price tag that's attached to that. And not to mention all the marketing that we have to pay to bring the patients in, the staff that we have to pay for that person to get busy. When somebody comes into a new practice and they get busy, yeah, I mean, they bring a skill set, but it takes a whole lot more than your own skill set to bring in a new plastic surgeon to practice and get them busy. It takes the marketing machine. It takes the reputation of the practice that you join. It takes the staffing. It takes a great website. It takes an ease of booking, an ease of consultation, an ease of, converting somebody from a potential patient into a paying patient. So all these things, somebody who starts a practice is clueless about, unless they have done it before, in which case they would appreciate it. But, so those are things I talk to about when we bring in new staff members or associates in the past.
So now that you built this out, because it sounds like you're almost at 10,000 square feet in Washington, D.C.
Something
That's got
like
to
that,
cost
yeah.
you a pretty penny.
It is expensive.
Yeah. But how worth it is it? See, some of the surgeons say, you know what? I don't want to get into all this non-surgical. I just want to do surgery. I make more money off of that, but then you're the only one. Then they say, well, I'll get another surgeon to use my surgery center 2 days a week when I'm not using it. Or they go the route you did, where you're trying to be the one-stop shop, to handle all of the cosmetic patient's needs. But then you have to manage all of that. You have to, the overhead on that is incredible. The marketing on that can be incredible, but the profit margins are different on that. So how did you work this out where it made more sense for you to just, get bigger, add more equipment, add more staff, manage them? How did you get to that?
I mean, I think, Catherine, it was more like a dream. I wanted to be able to offer my patients the best there is to offer. When I started out wanting to be a plastic surgeon, I didn't want to be a mediocre plastic surgeon. I didn't want to be, the guy who just barely gets by. And plastic surgery to me was a passion. It was not just a job. And for some people, it's just a job. And they go and work 2 days a week here or there, locum tenens, fly someplace that is busy with like a conveyor belt practice, like some of them in Florida, an alligator alley. You go do like, 6 Brazilian butt lifts a day, or, the lifestyle lift where you go do 3 facelifts a day. And that's fine for some people. Some people want to be employed by Sonobello. Some people want to be, employed in a hospital setting where they don't have to worry about anything other than seeing patients. I wanted to create an experience for my patients. I wanted, when the patients come here, to not only have a great cosmetic surgery result, I want them to have a great experience. And you cannot create a great experience if you're a Walmart. You have to be a Ritz-Carlton. And I think that's what we sought out to be. And, the doctor that I trained with in Beverly Hills, had a plaque on his wall that says, we have no qualms with plastic surgeons who charge less than us. They know their self-worth. Maybe a little bit crude and a little bit rude, but the philosophy is there, meaning I feel that patients, we don't want to attract, the patients are going to come and be bargain shoppers. In fact, I convince them not to come. If somebody wants to come and try to bargain, I say, you know what, there are plenty of plastic surgeons down the street that are cheaper than me. I think you'll be happy with them. I don't want those patients. I want the people who have done their homework, who appreciates somebody who has spent a lot of time perfecting his craft, who trains at conferences, who has plastic surgeons coming to visit. We have a plastic surgeon coming down from New York on a train right now, coming to watch me do a facelift tomorrow. We had somebody come a couple of months ago from Morocco to spend 2 weeks with us to train because he saw me giving a talk at a conference in Rome and he liked my results. We have somebody coming up from Mexico. So we have people coming from all over the world. And I think that we want to create a level of experience, whether it's for the patients or for visiting professors or visiting doctors, that is, suitable with the image that we have, which is, providing first-class results and a first-class patient experience. And if you go on our reviews, they don't just talk about our results. They talk about how wonderful the staff is, how wonderful our operating room staff is, how much they felt like they were at home. And you cannot do that if you're seeing 50 patients a day. It just doesn't work that way. So we're selective in who we accept as patients. We give them a first-class service, and we hope that not only they will enjoy, their experience, but they refer to us their patients. Because when a patient comes referred by a friend, they've already, that patient already enters into the practice at a higher level than somebody who just, Googled plastic surgeons within 20 miles of my house, Did I answer your question or did I ramble on?
No, you always get there. Yeah. Your office is absolutely gorgeous. Everyone should go to his website. It's very white marbly. It's just beautiful.
Well, I got to tell you a story about our office. So I built the Med Spa, which was our office, about 15 years ago, and I had the best designer in DC design it, and he's the guy who won international awards, and so it wasn't cheap. It was pretty expensive, but again, you have to decide what you want out of life. If you want to, have a champagne taste, you have to have a champagne budget. You can't have a champagne taste on a beer budget. So we got that guy who did an amazing office for us that was everything, our med spa, our surgery center, everything, 15 years ago. And the colors were our logo colors and our practice colors, which is gold and blue, which I'm happy to say that a lot of people in my area here have copied from us. So, my wife gets very upset when she sees people who have, stolen our colors and their offices and their websites look, like a copy of our colors, and there are like three in our own area that I can think of. And I always tell her, imitation is the sincerest form of flattery. So if people imitate you, you should be happy. You should not be upset. But then 5 years ago, when we opened up our surgery center, I went to the same architect, and an office right next door to our med spa opened up. So we decided to gut it all out and turn it into a surgery center. And he came to me, and he's like this, very sophisticated architect. He's like, well, Dr. Bitar, your first office was yellow, gold, and blue, and that was kind of like when you were in your teenage years, because the practice was, 15 years old. And when we opened this practice, we were 18 years old. Now we're 23 years old. It was 5 years ago. He goes, well, now you're an adult. So your office has to reflect the fact that you went from your teenage to your adult. So we're going to make the whole office marble colors and gray, as opposed to the med spa that was blue and gold. And so that kind of reflects a certain sophisticated simplicity, if you will.
I'm so glad you did that, because it definitely has a new theme to it, has a different feel to it, and you will attract a better patient. Because it's always, it does take money to attract money, and you have to decide, who do you want to be, the beer or the champagne, but just pick one. Nothing's right or wrong, just what's good for you.
Well, Catherine, when I first started my practice, I knew for a fact that you cannot be a successful cosmetic surgeon and reconstructive surgeon.
Yes. Yes.
When I was in my residency at UVA, in the clinic, we used to have the prisoner who was shackled in his jumpsuit because he had a boxer fracture, sitting next to the wife of the chairman of some big company coming for her facelift consult. It doesn't work that way.
Yeah.
So when I first started my practice, I knew that the minute I passed my board exam, I want to be 100% cosmetic. I didn't want to do any reconstructive, any insurance, any emergency room. And so I started the practice 23 years ago, and we turned it into a cosmetic practice within a year and a half. So as soon as I passed my boards, I basically dropped call in all the emergency rooms. I dropped the insurances. And so for the last 21 years, we've been purely cosmetic. We don't take insurances. We don't cover the emergency room, and we don't do reconstructive surgery. And that makes our cosmetic surgery patients very confident that the person who's operating on them has done thousands facelifts, has done thousands of rhinoplasties, thousands of, transaxial breast augmentations. I think you get good at something when you do it repeatedly, not when you dabble in it.
But so many surgeons are afraid of letting that go. They're so risk averse.
Well, I'll tell you the analogy that I use, and it may upset some of the reconstructive surgeons, but here it goes. I said, when you start your practice, at least the way I did it, you start like with an empty pot. And when you have an empty pot, it's nice to, grow some grass in it or some weeds, because weeds in the empty pot are better than just having soil. But then if you want to grow a beautiful flower, the weeds will eat the flower. So the flower was my cosmetic practice, and the weeds were my reconstructive practice. So when I started the practice, I basically said, I'm going to do reconstructive practice until my cosmetic practice is busy enough that I'm able to stop doing reconstructive. And that's what I did. I didn't just start out saying, I'm not going to accept anything. I accepted everything at the beginning. But then within a year, I think my first year, I did about 86 cosmetic cases because I had to remember them for my board exam. And when I did my first 86 cosmetic cases my first year, I felt very comfortable that once I stopped doing reconstructive, my cosmetic practice is going to take off. And that's what happened. But for the people who are afraid to let go of one thing, you cannot be great at everything. It's impossible. In fact, some people criticize me saying, when I do all cosmetic, body, face, and nose, I'm doing too much. They say, you should give up the body so you can do face, or you should give up the nose or just do face or just do nose. I mean, I like to do all cosmetic, but by giving up reconstructive surgery and focusing on cosmetic, I think I've narrowed the scope of my practice to the point that I'm happy and I feel it's narrow enough. I don't want to narrow it any further than that.
That works for you.
It works. And then those people that I did tummy tucks on 20 years ago now come back for their facelifts.
Yeah.
The people I did the rhinoplasty on come back for their tummy tucks. The people I did facelifts on, I mean, I had a lady in the last year, she told me, I want to have a plan to do my whole body after she had lost weight. And she was very serious. We did her facelift and brow lift and upper and lower eyelid lifts. 3 months later, I did a breast lift and implants on her. And 4 months after that, I did her tummy tuck and a high-def liposuction. And I did all the surgeries, and I, spaced them out so we could do it responsibly and without her having any added risk. But I enjoyed operating on the whole body in different time periods.
There's no one way to do this. Just do it your way, What would you say is the biggest challenge of running a solo practice in today's world?
I think there are lots of challenges, and I think those challenges change with time. Like, I mean, I have 2 teenage kids. The challenge that the practice poses to me cannot be taken in isolation from my family challenges. I had a sick father and an older mother, and, my father had Alzheimer's for 13 years. He passed away a few months ago.
Sorry.
But taking care of my father and taking care of growing kids and taking care of the practice and wanting to be on top of everything and having to go to conferences and having to keep on, on top of my education and hire, manage the staff, it all takes a bite out of you. So I think the biggest challenge is to be able to keep things in perspective. There are some times in the practice where you need to do marketing. There are some times where you need to up your game, because if you keep marketing something that is obsolete, you can throw as much dollars on it as you want. It's not going to work. I mean, one example I give you is I do transaxial breast augmentations. And when I trained, in the early 2000s, there was a moratorium on silicone implants. So everything was done with saline. Well, transaxillary breast augmentation with saline implants is very easy because you make a small incision in the armpit and you slide in an empty saline implant and then you fill it with saline and you're done. So it was taking me 25 minutes and I had very nice results. Then, within 10 years, silicone implants came back on the market and they were gaining more popularity and people could sense that silicone implants gave a higher quality outcome than saline implants. And then, my wife, who's our executive director, came to me one day, said, if you don't do silicone implants from the armpit, we're going to lose the implant business, because I did my analysis and I found out that this year, nationwide, there's as many people asking for saline implants as silicone implants. And the silicone implants are on the rise. So if you don't do them, we're going to lose business. And so I went back to the drawing board and I learned how to do silicone implants from the armpit, because it's not easy. And I trained myself to do it from the armpit, under the muscle,
Nice.
and now I'd say 95 to 97% of my transaxillary breast augmentations are done with silicone. There are occasionally patients who come and want saline, and I do it for them. But the point is, our breast implant practice kept growing because we accommodated to the demands of the society.
I couldn't agree more. You have to hear the patients and what they want, and cater to them, if it makes sense, of course. But pivoting and adapting to change is everything, especially in today's world as it's moving so quickly. Give me a big business mistake that you made that others could learn from.
I think the biggest business mistake I made was when I first started my practice. I didn't have money, so I did things on the cheap. I hired a friend of mine who was a PA. Instead of having a plastic surgery PA, I hired a PA who was a family practice PA just because the price was right. I also did paper charts because I felt like doing electronic medical records was going to be very expensive. And I didn't buy any lasers. I sort of like became friends with a med spa that allowed me to use their lasers. And so I would say the lesson I would give is sit down, do a business plan for yourself. And if it takes going to a bank and borrowing money to start your practice or to advance your practice on a high end, I think the money that you spend at the beginning, you'll make it up 10 times more than if you start being on the cheap and hope that you're going to grow. Because also in cosmetic surgery, image is important. So if you start out with having, like sloppy records or paper records or staff that don't, project a cosmetic image, yeah, they will be affordable and they will be cheap. But the problem is, if you get one patient in your office who is willing to spend a lot of money, but is turned off because they feel that you don't have your act together, you've lost that patient. And I've had patients that have been coming to me for 20 years that if I've lost, I've lost the income of 20 years worth. So I think the name of the game is to make yourself, within reason, as attractive to a potential patient who is willing to spend money as possible, and have an operation that projects not only confidence but projects a high level of patient care. We are cosmetic surgeons. Unlike a podiatrist or a family practitioner, if you walk into their office and it smells with food, or the staff is disheveled, or you walk into a room and there's a dead plant, you don't care because you need them. We are different. I would not tolerate anybody walking into my office and finding a dead leaf on a plant, because they say, oh my God, if they don't take care of their plants, then they're not going to take care of me. And whether it's right or wrong, that's how patients think sometimes. Or if your staff at the front desk has garlic breath, you may turn off a patient who was willing to come and spend a lot of money. So details count. And so I would say, in summary, the mistake I made was early in my practice, I didn't realize that I was saving pennies, but I was losing dollars on the back end of that game.
Good analogy and good advice on that one. Good for you. Last question about business. Any plans to grow and or exit?
Well, I feel like I'm really enjoying my practice now. I've gone through some iterations of the practice, and I feel right now I'm in my happy place.
Good.
You know, I have two teenage kids. I have a wife that I love. I have parents around me. I have great friends. So the melange of the amount of time I spend in the office and the amount of time I spend at home, the amount of time I spend traveling is just the right mix for me. So I just hope that what I'm doing right now, you know, never ends. I'm sure everything ends and I'm sure things will change. But I got to a place where, like, this is the practice that I dreamed of, that I wanted to build. You know, everything under one roof with great staff, great patients. I love them all. I'd like to think they love me too. And every day when I come to the office, it's just a joy. I mean, I had a patient today who came, like, you guys have too much fun here. I'm like, yeah,
Mm,
that's the way it's supposed to be. You know, you go to a practice and everybody looks like they got like a stick up their ass. You don't want to be operated on over there, right?
good job.
So I don't have an exit strategy right now. You know, I've been approached by a lot of VCs to buy my practice. Like, I'm really not interested.
Yeah. Let's move on to marketing. How do you differentiate yourself from your competitors because you're in a super competitive area there?
Yeah.
How are you doing that?
So when I finished my practice, I got lots of job offers all over the world because I trained on all six continents, and I came to open up in the DC area because my family was here. And I remember a senior surgeon telling me, "You're going where to DC? You know, you're going to the highest densely populated plastic surgery place in the whole world." I didn't know that at the time, but then come to find out that it's true.
Hmm.
And if it's not the highest, it's one of the highest, let's
Yep.
say. I think at the end of the day, you cannot lose track of what we do for a living. We are surgeons. We operate on people. And at the end of the day, people are going to look at their results and they're either going to like their results or they're not going to like their results. And, you know, if they like their results, everything else falls in place. If they don't like the results, you can do all the marketing in the world and it's not going to help you. You know, J.F. Kennedy said something that I really like. He said, your actions will speak for themselves. If your actions are strong, you don't need to speak. And if your actions are weak, all the words in the world are not going to rescue you. And so I think there's some truth to that. So, first and foremost, I think the most important marketing is to give your patients good results. And by good results, I mean listen to them, find out what they want, do the surgery that you promised you're going to do, be honest with yourself and your patients, what results you're able to give them. If you cannot give them the results that they want, you know, don't bullshit them and don't bullshit yourself. Tell them that, you know, what you're asking for is outside of my capacity. And I've done that a lot. You know, when I started my practice, I had somebody who came in for like a fourth time redo nose that required rib graft. I was like, you know what? I know exactly what you need. I've done it in my residency, but it's beyond my capacity. And I don't think I should be the one who operates on you. And I think people appreciate that. You know, I trained with Dr. Pitangui in Brazil, who was arguably the biggest plastic surgeon this world has ever produced. I mean, the guy was a legend in his own time. And Dr. Pitangui would tell me when we were operating, he says, George, we make our money by the people we operate on, and we make our reputation by the people we turn away.
Hmm.
And so don't be afraid to make your money, but also don't be afraid to turn people away if you don't think that you are going to be giving them the best result. So the first and most important rule of marketing is be able to deliver good results. You know, if you cannot, either learn how to do it or refer them to somebody else. I think that's the most important thing, especially early in your practice, because in your early practice, your mistakes are very costly. If you have a very bad mistake, it will haunt you forever. You know, if you have a death in the operating room because somebody was on blood thinners and you did not think to stop those blood thinners, you know, those are very costly mistakes. And the reverse is true. If you do good work at the beginning of your practice, you'll get known as the person who is new on the block but does amazing work. And now with social media, you know, those results are amplified. The good is amplified and the bad is amplified. I mean, yesterday, Kylie Jenner, you know, revealed that she has 445 cc's of silicone implants in a dual plane by Dr. Garth Fisher. And
Oh, wow.
today, I think there's only one monk in the Himalayas who has not heard about it,
I
right?
didn't hear about it. Good to
So,
know.
good or bad news travels very fast. So, you know, so the first thing is, if you are very confident about what you're going to do that you've learned in your residency, great, do it. If you're not confident about it, go learn about it. There are videos. You can go, visit people to learn from them hands on. You can go and do cadaver dissections. We do a lot of cadaver courses. We just did one in New York where we did facelifts on cadavers to train new plastic surgeons how to do deep plane facelifts. So the tools are more available now than they ever were. And so there's no excuse for a young plastic surgeon not to up their game. So that's one thing, how to attract patients in a competitive area. Number one, know your capacity and continuously improve yourself. Number two, listen to what the community is looking for. If people are telling you, I want a deep plane facelift, and you want to tell them, I only do smash facelifts or I only do skin only facelifts, you can be the world's best skin only facelift surgeon in the world, or you can be the best smash facelift surgeon in the world. If that patient has done their homework and they want a deep plane facelift and you're not going to offer it to them, I don't care how nice your office is. I don't care how many diplomas you have on your wall. They're going to go to somebody who's going to offer them a deep plane facelift. And so when I saw that the trend was going to the deep plane arena, I did cadaver dissections. I trained with the best of the best in the world. And I was able to offer my patients what they were asking for, which is deep plane facelifts. And a lot of things that we do in private practice, we may not have learned in residency. But the beauty of cosmetic surgery is it's a very creative field. I'm an artist before being a plastic surgeon. And what attracted me to plastic surgery is there are no two people who are the same. That's why I trained around the world, because no two noses are the same. Different cultures affect what we do as plastic surgeons to our patients differently. So it's very exciting if you buy into it and if you enjoy doing it. And I love every minute of it. And if you don't like it, maybe it's not for you. Maybe you should be doing reconstructive surgery, because cosmetic surgery is very creative and you have to keep pushing yourself. You have to keep learning new things. You have to keep on top of everything. Another example is, 5 years ago, I started hearing about preservation rhinoplasties and piezo rhinoplasties or ultrasonic rhinoplasties. And I'm like, wow, that makes sense. Instead of having a hammer and chisel cutting the bone, if you have a small electric saw that can cut the bone in a laser-like precision, why not? I mean, does it need to have a learning curve? So what? I've gone through 9 years of residency. I can learn a new technique. It's not a big deal. So I got the machine. I learned how to do it first on cadavers in a couple of courses, and then I went and learned how to do it in the operating room, and and I incorporated it into my practice, and my patients love the results. And on preservation rhinoplasty, I always said, when we're doing a rhinoplasty, we should not be removing stuff. We should be rearranging stuff in the nose. Mm-hmm. And lo and behold, it's like a whole new direction, if you will, in rhinoplasty surgery. So again, I took courses. I went online. I at night I was like looking at videos all night long. I spoke to Gerbeau, the guy who started piezo rhinoplasties. I went to courses with the guys who started preservation rhinoplasties. I started doing slowly into my rhinoplasties because I have a big rhinoplasty practice. So, if you want to adapt to a new technique, it may not be all or nothing. Start doing small components of a deep plane facelift. Start doing small components of a piezo rhinoplasty or a preservation rhinoplasty until you feel comfortable, and then you can go, full throttle. And that's what I did. And patients appreciate you being honest with them. You explaining to them what you're going to do and how you're going to do it and why you choose one technique or the other. And that's how you build trust, and that's how your patients trust you and go along with you. Another new technique that I incorporate in my practice, and endoscopic approach forehead lift, that I feel is simpler than the old technique of either a bicoronal forehead lift or just a small temporal lift. It's somewhere in between a very minimalistic approach or a very aggressive approach. And I think an endoscopic approach, forehead lift, kind of hits the nail on the head, especially when you combine it with a deep plane facelift, so that it will just give an overall great rejuvenation of the upper third of the face, whereas the deep plane facelift gives a great rejuvenation to the lower two-thirds of the face and neck. And so, again, I learned how to do the endoscopic forehead approach. I combined it into my practice. I was doing forehead reduction approaches before. I kind of upped my game on that. So, even if you've been in practice for a long period of time, I think it's a mistake to say to the patients and to yourself, this is what I do. I've been doing it for so long, and I'm happy with it, and that's it. Because if people are requesting a new technique because they've seen it on social media and you don't offer it, you're going to lose that patient. It's as simple as that.
But on the other hand, if they've never heard of it, but that nuance of you're improving it, it's just trying to educate the patient on why you're different. That's why, because of the nuances of the new techniques and the innovative techniques that you have perfected. Does it make the consult longer? Does it confuse the issue? Like, how do you educate that patient on why this matters to them?
So I think that patients care about things maybe that we as plastic surgeons don't care about.
Mm-hmm.
Number one, they care about their result. Their end result is the most important thing to most patients. Number two, they care about going back to work or going back to their life quickly. And number three, they care about having the least amount of pain possible. I mean, those are very obvious things. But, when I talk to them about the deep plane facelift technique or a piezo-rhinoplasty technique, quite frankly, they don't care. What they care about is they want to have a facelift that looks good, they look natural, it's long lasting, they don't want to come back to have another facelift in 5 years, and they recover quickly, they go back to work. We have a lot of patients who fly in for surgery. I had a woman who came in from South Africa. I had a woman who came in from Lebanon. I have somebody who came in from Guyana, from South America recently. And, when I tell them, you come here for 10 days, we'll take care of you, and then you go back, I have to be able to live up to that promise because they have their life. So if I do that, this lady from Guyana has been coming to me now for like about 10 years. I've done like about 5 or 6 surgeries on her. It never fails. She comes every couple of years. I do her surgery. She goes back. She comes back. She does other things. She brings me, her friends, other patients. So, you have to be able to give the patient what they want. And what they want is, again, results. So you show them a lot of pictures. You explain to them the surgery. But the way I explain the surgery is in context of what it's going to do for them. Yes. They don't want to hear big words and what you do with the SMAT and what you do with they don't care about that. All they care about is I'm going to be able to give you what you want, and that's the way I'm going to be able to give it to you. Now, I live in a very highly educated area in the DC area where, half of the people are lawyers, the other half are doctors, the other third are government, contractors. So they all have, MBAs, PhDs, MDs, JDs. And so the more educated the patient, I think the more you have to dive into explaining what you do, to explain to the patient that you know what you're doing and you're going to give them what they came here for. Because if a patient knows that you understand what they want and you explain to them in detail how you're going to give it to them, they're not going to go somewhere else. They're going to say, okay, Dr. Bitar understood what I asked. And I have a board in every room that I draw on it, their noses, their facelifts, their tummy tucks, their breast lifts. I tell them exactly what I'm going to do. And I tell them, if we're not on the same page, tell me now, because I think it's important that when you walk out of here, we're either on the same page or maybe I'm not the surgeon for you. And typically, we are on the same page, and they may end up choosing somebody else as their surgeon, but I think they don't walk out of here saying, oh, Dr. Bitar didn't listen to me and he's clueless as to what I want. I don't think that ever happens.
Mm-hmm. Let's talk about marketing, because you need to market yourself, but you also need to market the non-surgical side. And that can oftentimes take a lot more marketing to grow that med spa and the wellness center. How are you doing that? And you have a lot of international clientele, which tells me you must be using social media for that, because Google's not going to show you to other countries. They just aren't. They're going to keep you local. So how is that? How are you working that out?
So it's interesting you say that because in 2012, I was at a plastic surgery conference in Cancun, and I gave a talk about the new age of Google and marketing on Google. And at the time, doing a talk on Google, believe it or not, was new to most plastic surgeons. It's not that long ago, but and I remember Sam Hamra was there. Do you know who Sam Hamra is?
Mm-mm.
Sam Hamra is the guy who wrote the book on deep plane facelift.
Oh,
In 1990, he wrote the first book on deep plane facelift. So he was an authority in the world of cosmetic surgery from Texas, and he was arguably one of the best plastic surgeons in the world at the time.
mm.
And so, in a previous talk, I had heard Sam Hamra criticizing a fellow plastic surgeon about the fact that he advertised in the airline magazines. And look at that guy, he has his picture in the airline magazines. And we as plastic surgeons should not need to advertise or not need to market. People should come to us because of our work. Now, at the time, I was early in my career, and that was like 13 years ago. And so I kind of wanted to do a tongue-in-cheek slide about marketing. And so I put a slide up there, and I invited Sam. I said, Sam, you need to come and see my talk because I have a slide about you in it. And so, really? Me in your slide about marketing? I was like, yeah, you got to come and see it. So basically, the slide said, one half of the slide was Sam Hamra himself, and the other side was a woman in a bikini who had like beautiful 36C breasts. And the slide read, Sam Hamra telling you you don't need to market yourself as a plastic surgeon is like this woman telling you you don't need breast implants. So the point is, if you've been a plastic surgeon for 30 years, yeah, you don't need to market yourself. You're already there. But for somebody who's new, you do need to market yourself.
Yep.
Just like a woman who has 36C breasts, is easy for her to say, well, oh, no, I would never, ever have breast implants. But somebody who's flat-chested, does not appreciate that or does not agree with that. So basically, the long and the short of it is you need to market yourself as a plastic surgeon because there's so much noise out there that you're not going to distinguish yourself if people don't even know that you exist. So the first step about being a successful plastic surgeon is doing a lot of surgeries that turn out to be good. But the first step of doing lots of surgeries is for people to know who you are. I mean, I named my practice the Bitar Cosmetic Surgery Institute because when I came and opened up my practice, I would see a lot of people who've been operated on by plastic surgeons and they forgot their name. I'm like, I don't want anyone to forget my name. If you want to call it egotistical, you can, but that was not the goal. My goal of naming my practice the Bitar Cosmetic Surgery Institute is so that for the doctors, when they are voting for the top Washingtonian plastic surgeon to remember my name, and for the patients who they came and had a consultation and they decide they want to have their surgery a year later, if they've met with 5 other plastic surgeons and one person's name is the Greater Washington, D.C. Plastic Surgery Associate, the other one is the Advanced Aesthetic Practice, the third one was the Cutting Edge Plastic Surgery, and the fourth one was the Bitar Cosmetic Surgery Institute. Who do you think they're going to remember?
Yeah. Bitar. I say it all the time. It's such a paradox, though, because you're trying to give yourself a neutral name so you can sell down the road. But first, you need to grow the practice with your name for the first 30 years. So I don't know what the answer is, but I think it's your name. And worry about the whole thing later. Worry about that.
I go all over the world right now to give the talks, and people come to me. It's like, oh, you're Bitar? I'm like, yeah. Yeah. So
yeah.
I had even a guy in my practice in the med spa. So I go, because our PA was sick that day, so I had to go from the surgery center to the med spa to inject somebody who was not, had not met me before. He was being injected on by my PA injector, and he saw on my gown it says George Bitar. He goes, you're George Bitar? I said, yeah. He goes, how did you make them name this practice after you?
That's
It was
funny.
kind of funny.
Yeah. So what's working best for marketing channels? Because Washington still has a lot of old school, like the Washingtonian magazine.
So Washingtonian magazine works, but not the advertising section. It's you being a top doctor in Washingtonian, because
Mm-hmm.
that is something that you have to be voted for. And I would say only 7% of the plastic surgeons in the in the area here get voted as top plastic surgeons in Washingtonian. And that is a very credible honor that most Washingtonians, keep that Washingtonian top docs issue, and they choose their doctors, not just plastic surgeons, but other doctors based on what they read in the Washingtonian. Other channels, I think, is a website. I think you have to have a website that reflects who you are, because when people, I haven't carried a card with my name on it in over 10 years. I don't give people cards. I said, my name is George Bitar. You can go Google me and go to my website, and I'll tell you everything you want to know. If you're interested enough to have me as your surgeon, do that. If you're not interested, then giving you a card is a waste of my time and a waste of your time. So your website is your own, your new business card. You go to somebody's website and you can judge whether they're the plastic surgeon that you want as your plastic surgeon based on how much thought and how much artistry and how much results went into their website. If you see a website that was, last updated when Eisenhower was in office, you're not going to have a great impression of that plastic surgeon. And if their pictures, the one picture has light on it, the other one has shade, one has like, a blue curtain in the background, the other one has like a little kid in the background screaming, you're not gonna, that's not the person that you want as your plastic surgeon. So we try to maintain a very professional website, and we take very great care in our before and after photos to be as close as to each other as possible. Sometimes, because we have international patients, they send us their after photos after we operate on them, so we have no control over that. But I figure we show them anyway, just to let people know that we have patients who flew in, from South America, from Europe, from the Middle East for their surgery, and the only way we have, after photos is because they send them to us, but they're not coming back for their follow-up visit.
Yeah. No, you have a very comprehensive website. How about Google AdWords? You using that?
So we do, Google AdWords, but to be honest with you, the thing that works on Google is Google reviews. I think, the consumer right now is very sophisticated. They see through things that are artificial. They see through, your own advertising. They see through your own testimonials. I think what they want is they want to see patients talking about you, patients genuinely writing reviews and saying things that are genuine, not, oh, he's a great plastic surgeon and that's it, talking about their journey with you, and having some bad reviews is not a bad thing. I
Right.
think it lets people know that, I'm not willing to compromise my standards to please everybody. If you want to please everybody, you're going to please nobody. So there's going to be some people who, no matter how hard you try, are going to give you 1-star reviews. That's life. Live with it and accept it. But reviews online, I think, are things that people pay a lot of attention to. I think that YouTube videos of a patient. I have a celebrity patient who talked about her breast augmentation journey. It got over 1 million reviews. And I did a lot of breast implants based on that person showing her whole journey. We have a celebrity here in town I did a facelift on, and even though he would not allow me to put his picture on my website, but people know him in town, and every time somebody asks him, who did your facelift, he tells them it's Dr. Bitar. So, word of mouth was more powerful than me putting him on my social media.
Nice.
So there's this and that.
Any tips on getting consents from patients for reviews and photos? Anything you're doing to make that happen more often than not?
Yeah, so I think tips for photos. You have to be honest with the patient. Say, look, I'd love to use your photo.
Mm-hmm.
And when somebody's, oh no, Dr. Bitar, you cannot use my photo. I give them my my analogy. I'm like, okay, so pretend I was Leonardo da Vinci and you're the Mona Lisa. Are you going to come to me and say, oh, you did such a nice painting of me, but you cannot show it to anyone? I said that would have changed the course of history.
Does that help?
Yeah, it
Yeah.
helps.
That's a good analogy.
I put it on my Instagram, and I had a patient who came to me, months later and said, Dr. Bitar, I just want you to know that if you're going to give me a Mona Lisa-like result, I'll give you the permission to show it. So it worked.
Well, I know that you've also done a really good job on social media. You've got like 90,000 followers. And when we were at that meeting, you are all over. I keep forgetting to take the photos and the videos, and you are on it. Do you spend a lot of your time on it, or just when you're away and you have a team at home?
I mean, I just came back from Monaco. I took a lot of pictures and I send them to the various plastic surgeons. I think they appreciate that when you're on the podium giving a talk, you appreciate somebody taking pictures of you and sending it to you without you having to beg 10 people to do it. And honestly, there's an art to doing it, because when you're on the podium, you want pictures of you that show a nice screen behind you. You don't want to show in front of you empty seats. You don't want to look like you're sitting on the side of a wall. So when somebody's on the podium, I go to the side and take a picture of them from the side, so they have the screen behind them, not a wall behind them. Mm-hmm. And if there's like people in the front row, but like after that, there's, nobody sitting there, I try to take a picture and show that there are people in the audience watching that show. I try to take small videos. So number one, you can text it to them or airdrop it. Because if you take a video more than 1 minute, it's a useless video. You cannot airdrop it. You cannot text it. It ends up on your phone. So I try to do these things. And if you do 2 or 3 per person on the podium, they appreciate that, because, now they can use it on their social media and they'll like you for it. And I like to be liked.
Do you spend much time on social media, like throughout
I do, because I like it. I tell people, if you don't like it, you should not do it.
Right.
I think I'll use the analogy of social media as like the gym. When I go work out in the morning, I feel it's a treat. I love working out in the morning. I drop off my kids at school, I work out in the morning. But the mornings I have to operate, I have to be in the office at 6:30 in the morning. I can't go to the gym before that. I work out in the afternoon. So working out in the morning is a treat for me. Working out in the afternoon is a chore. So if social media is a treat for you, you should do it. If it's a chore, then either have somebody else do it or don't do it. Because I know people that social media has made their life miserable. You don't want to be miserable. It has to be something that enhances your life. Life is too short to do something that you absolutely hate doing. And I see plastic surgeons who are like in their 70s right now at meetings and wanting to take videos of themselves because they have to do it. Otherwise, when they go to their office manager will yell at them because they didn't get any footage. And I'm like, you know what? Life is too short to do something that, for you is like taking medicine. Don't do it. Mm-hmm. But I like it. Yeah. And I have separated my social media into 2 components. My own Dr. George Bitar Instagram that I do only personal things on, and my the Bitar Institute one, and we have a Med Spa one. So we have 3 social medias. And I am the past president of the Association of Plastic Surgeons of Lebanese Descent, and so that's an association I was one of the founding members of in 2010. So I do the Instagram. It's APSLD 2025. So I basically manage all the Instagram posts, and I do it as a labor of love. I do it because I enjoy doing it. Like right now, we're in Monaco at a meeting there with the French Society. So I posted a lot. I reposted things that other people posted, and I posted on my own Instagram, my personal stories. So I try to separate what to put on Instagram, what to put on LinkedIn, what to put on Facebook. Every social media has its own vibe and its own, what is acceptable and not acceptable to put on it.
Yeah. All right. We're getting down to the why you're here. Give me a crazy patient or staff story you care to share.
So patient story. This is kind of like funny, not the crazy.
We'll take funny.
So this is a patient of mine who was from Nigeria. She was a very successful lawyer, and she came for her facelift from Nigeria.
Mm.
And after we did the facelift and she had a nice result, I wanted to get her permission to show her results, and she would not allow me to show her results. And I was like, but you're in Nigeria, we're here, what's the big deal? She's like, Dr. Bitar, I am a lawyer, but I have a company that does plastic surgery tourism. So I send people from Nigeria to Europe
Ah.
to get plastic surgery, mainly to Turkey, but also to other places in Europe, Spain, Italy, Turkey, other places. So she goes, so for them to see that I sent them over there and I came to you to have my facelift, I think it's going to make my customers upset. I said, why did you come then over here? She goes, well, I came here because for me, price is not an issue. For my customers, price is an issue. So I took that as a compliment. So instead of me being able to use her picture, she got me a nice, beautiful painting from Nigeria to put on my wall. She's like, I'm sorry you can't use my picture, but as a way of thanking you, she got me this beautiful painting that I could use.
Oh, that's nice. But
So
how does a Nigerian lawyer become the go-to person for plastic surgery? What's
I
that?
don't know.
Okay.
She had her own thing going on over there, but I did not ask questions. But here's another good story.
Mhm.
I did a rhinoplasty on a woman who was Middle Eastern, and she had a big nose that she was not happy with. I gave her a beautiful nose, and then when she came back for her 1 day follow-up, um, even though she still had the splint on, and even though she did not look, she did not know what the results are going to be, she got us baklava. And she said, I am a chef, and those are my homemade baklava. And I do them from scratch, from honey, from my own flour, ingredients, and stuff. And all the staff tasted it, including myself, and I loved it. I'm from Lebanon. I appreciate Middle Eastern pastry, and her baklava was like the best I've ever tasted.
Ah.
I said, well, thank you so much. And then, she came back for her 1 week follow-up to take the splint off, and she got us another, dish of baklava. And I took her splint off, and she loved her nose. She started crying, like, oh my God, that's the nose I've wanted, and this and that. And again, the baklavas were great. And usually after the 1 week follow-up, I'd tell people I'll see you back at the 1 month follow-up. I told her, listen, your nose is very special to me, and I cannot afford to wait 3 weeks to see you. We need to see you every week,
Mhm.
with the understanding that when you come, you have to bring us baklava with you. And I meant it as a joke,
And
but
she
she
bought.
took it seriously. And so for the next 3 weeks, actually for the next 7 weeks, every week she would come and get us baklava. I said, enough already. My staff is going to hate me
Yeah.
for doing this because they're getting fat. But it was a fun story of somebody who kind of like was appreciative and brought us, food for their surgery. So I appreciate things like that.
Oh, that's so sweet. Last question. Tell us something we don't know about you.
Well, to tell you something you don't know about me, I think I do take my work seriously, but I take my life and my wife and my kids more seriously. And I think they're my world, and they're my joy. And I have a wonderful, beautiful wife that I've been married to now for 19 years,
She
Rima.
is amazing, by the way. She is your right-hand person, your go-to person, your
She's
buffer,
not
your
my right
everything.
hand, she's like my head.
She's amazing. Yeah.
She is an amazing wife, an
Mhm.
amazing executive director, an
Yep.
amazing mother, an amazing daughter-in-law, an amazing daughter. I think I'm very lucky to have her, and I hope she doesn't hear this because then her head will get bigger.
She-
Um,
you
no,
picked well.
seriously, I think she is by trade an electrical engineer. She has a PhD electrical
Oh, I
engineering
didn't know
from
that.
UCLA, and she basically graduated the top of her class. So she won the Teacher Award of the Year. So she loves to teach, and her love of teaching has translated into being able to verbalize what we need in the practice to our staff, to our patients, whether by training the staff or whether by hiring people. I feel people appreciate her candor.
Yeah.
She's not the easiest boss to work for, I can tell you that. She's a hard ass. But, she expects a lot from herself and she expects a lot from the people around her, including myself and our kids. I think she's a wonderful mother. My kids, I have John, who is 15, is now a sophomore, finishing his sophomore year in high school. He's a wonderful, wonderful boy. And as far as his mother is concerned, he's the most handsome, most smart, most intelligent boy in the world, and no girl is good enough to marry him in the future. And then I have my daughter, who's 13, Gabriella, beautiful, smart. They're both very athletic. And, I like to have a practice that is busy so that when I leave here, it's successful. I can go. And when I'm at home, I have my 100% of my attention to them. I stopped working evenings. I stopped working Saturdays, which I used to do before I had kids, to be able to spend more time with them. And, when we go on family vacations, to me, that is way more valuable than any meeting I go to. And so I want them to understand as they're growing up that there is a passion that I have for work, but they are my first and foremost priority. And I try to, let them know that, we work sometimes long hours. I go to conferences. I spend time sitting and writing and giving lectures and talks. So maybe sometimes the message doesn't come across 100%, but in no uncertain terms, they are my priority. So those people who see me through the lens of being a plastic surgeon, to me, the biggest achievement and the biggest honor I have is being a father and a husband.
Yeah. Any interest in them? Are they showing any interest in following in your footsteps?
I mean, it's too early to tell, but I think my daughter wants to be a marketer. She comes to the office, she hangs out with our marketing director, and she teases me to tell me that the video that we've done in our practice that had the most views on Instagram was the one that she did
The one
2
in the
years
kitchen?
ago when she was 11 years
It
old.
was darling. Yeah, I saw it
She
too.
came and pretended that she was my assistant, and she wore oversized gloves, and she was handing me the injectables, and she was giving me a high five with the gloves flailing.
So
And
cute.
patients adore that, and she always likes to stick it to me that the most viewed, Instagram video was not something I did when I was giving a talk in China or Monaco, as she says, but the one that she did when she came to my practice.
That is so cute.
My
I did
son
not know
was
that. I've got to go check that out.
There you go. And my son is into finance. He has his own stock portfolio at 15. And, he went as a stockbroker to Halloween as a Halloween character once. So he has done, summer courses, taking finance courses, and he feels like he can help people the most by being a financial advisor and helping them how to manage their money. So they have different passions, and I support them whatever they decide to do, as every parent should, I think.
Yeah. Well, I'm glad they picked normal things that actually are needed in the business world. That's good. Yeah, off to a good start there. So we're going to wrap it up now. Thank you so much, Dr. Bitar. It has been a pleasure. I'm so glad we got to talk about not COVID stuff.
No kidding. That was a bad era, and thank God we're over it.
Yeah, that was crazy. And you've just grown such a beautiful practice. Everybody, go check out his website. He has done a very good job with content and with organic SEO. Watch how he runs a patient through the journey. It's very interesting. The website is content heavy. And you've got to be getting killer traffic on that because you're keeping the patient interested and on your website a lot longer than others who haven't gone to the trouble of.
And Catherine, I think our Instagram, the Bitar Institute, I think engages people. I think we tell genuinely good stories.
Yeah.
We let our patients speak for themselves. And I think our Instagram is a good mixture of patients, staff stories, and just overall things that are important and educational and entertaining for our current plastic surgery patients and for the prospect plastic surgery patients and for plastic surgeons who want to see what our techniques are and what our results are.
Yeah. Well, you need both. And I think a lot of times Instagram is getting them to your website, but then on a website, you have a lot more real estate there and a lot more opportunity for them to dive deeper. Instagram can go very fast. And but you need both, quite frankly. But check
Yeah.
out his website. It's bitarinstitute.com. And then his Instagram is the Bitar Institute. Yeah. And with that, we're going to say goodbye. Thank you so much. And everybody.
Thanks for having me, Catherine. It's always a pleasure to be with you.
Absolutely. Everybody, if you would, please subscribe to Beauty in the Biz so you don't miss any episodes. And I'd love a review as well. And then if you've got any questions or feedback for me, please leave them on my website at catherinemaley.com, or you can certainly DM me on Instagram at catherinemaley.mba. Thank you, and we'll talk again soon.
The fastest way to success is to model other successful surgeons who have what you want, but you can only see their results, not the path they took to get there. So you continue to jump from one thing to another, hoping to find something that will work for you too. But it rarely does. So try this shortcut instead. It's guaranteed to move you forward. I compiled my intellectual property to grow cosmetic revenues, everything I've gleaned over the years, into one playbook of the most successful practices and what they do to win. Go to cosmeticpracticevault.com and let's grow your cosmetic revenues.